Vitamin B12 is crucial for our health. It's a water-soluble vitamin. This means our body doesn't store it. We need to replenish it regularly. B12 plays a key role in many bodily functions. These include cell growth and development. It also helps with energy production. Unlike some nutrients, our bodies cannot make vitamin B12. We must obtain it through our diet or supplements. A deficiency can lead to various health problems. It's important to understand the role of vitamin B12. Vitamin B12 is a powerhouse nutrient. It impacts many critical functions in the body. One of its primary roles is in red blood cell production. Red blood cells carry oxygen throughout our body. B12 deficiency can lead to anemia. This results in fatigue and weakness. DNA synthesis is another process B12 is involved in. DNA carries our genetic information. It's essential for cell growth and repair. Without enough B12, DNA synthesis can be impaired. This can have wide-ranging health consequences. Vitamin B12 is also crucial for a healthy nervous system. It helps maintain the myelin sheath. This sheath protects nerve fibers and ensures proper nerve impulse transmission. B12 deficiency can damage the myelin sheath. This leads to neurological problems like numbness, tingling, and problems with balance. In essence, vitamin B12 is a key player in keeping our bodies functioning smoothly. From energy production to cell growth and nerve function, its roles are diverse and vital for our overall health. Vitamin B12 deficiency can arise from several factors. One of the most common is a dietary insufficiency. This is particularly common in people following a strict vegan diet. Animal products are the primary source of B12. Vegans must rely on fortified foods or supplements. Another major cause is malabsorption. This refers to the body's inability to absorb B12 from food. Certain conditions can cause this, such as pernicious anemia. In this autoimmune disorder, the body attacks the cells that produce intrinsic factor. Intrinsic factor is a protein crucial for B12 absorption. Certain medications can also interfere with B12 absorption. These include proton pump inhibitors or PPIs for heartburn. They reduce stomach acid, which is necessary for B12 absorption. Metformin, a common diabetes medication, can also interfere with B12 absorption. Other factors contributing to B12 deficiency include age. As we age, our stomach produces less gastric acid, making it harder to absorb B12. Certain gastrointestinal disorders like Crohn's disease and celiac disease can also affect absorption. Understanding the various causes of B12 deficiency is essential for identifying those at risk. Early detection and treatment are crucial to prevent long-term health complications. Recognizing the symptoms. Vitamin B12 deficiency often develops gradually. Symptoms might be mild at first and they can be mistaken for other conditions. One of the most common symptoms is fatigue. This feeling of tiredness and lack of energy can be persistent and debilitating. Pale skin is another common sign due to a decrease in red blood cell production. Neurological symptoms are also common with B12 deficiency. These can include numbness or tingling in the hands and feet. Difficulty walking and loss of balance are also possible. In severe cases, B12 deficiency can lead to cognitive problems such as memory loss, confusion, and dementia. Other symptoms may include a sore and red tongue, mouth ulcers, and shortness of breath. It's important to note that these symptoms can also indicate other health conditions. Diagnosing the deficiency. Diagnosing vitamin B12. Deficiency typically involves a simple blood test. This test measures the level of B12 in your blood. A low level indicates a deficiency. In some cases, additional tests may be necessary. These can help determine the underlying cause of the deficiency. For instance, if pernicious anemia is suspected, a doctor may order a test for intrinsic factor antibodies. These antibodies attack intrinsic factor, a protein needed for B12 absorption. If malabsorption is suspected, a Schilling test may be performed. This test measures how well your body absorbs B12. It involves taking a small dose of radioactive B12 and measuring the amount excreted in urine. Early diagnosis of B12 deficiency is essential. Treatment and management. Treatment for vitamin B12 deficiency typically depends on the severity and underlying cause. For mild cases, dietary changes and oral supplements may be sufficient. This involves incorporating B12-rich foods into the diet. Supplements can help bridge the nutritional gap. For more severe deficiencies or cases involving malabsorption, injections are often necessary. B12 injections bypass the digestive system and deliver the vitamin directly into the bloodstream. This ensures proper absorption and faster replenishment of B12 levels. The frequency and duration of injections vary depending on individual needs. Some individuals may require lifelong injections, such as those with pernicious anemia. Others may only need a short course of injections to restore B12 levels. In addition to addressing the deficiency, it's crucial to manage any underlying conditions contributing to it. For instance, treating digestive disorders or adjusting medications that interfere with B12 absorption can help prevent future deficiencies. Preventing vitamin B12 deficiency. One of the most effective ways is to ensure an adequate intake of B12 through diet. Excellent sources of B12 include animal products such as meat, poultry, fish, eggs, and dairy products. For those following a vegan or vegetarian diet, fortified foods like plant-based milk, cereals, and nutritional yeast are good options. B12 supplements are also available for those who struggle to meet their needs through diet alone. In addition to diet, certain lifestyle factors can help prevent B12 deficiency. Maintaining good gut health is essential, as a healthy digestive system absorbs nutrients more efficiently. This includes consuming a fiber-rich diet, staying hydrated, and managing stress levels. Regular checkups with your healthcare provider are also crucial. They can monitor your B12 levels, especially if you belong to a high-risk group. By making conscious dietary choices and prioritizing overall health, you can significantly reduce your risk of vitamin B12 deficiency and enjoy the numerous benefits of this essential nutrient.